Hello, my name is Daniel Rodriguez Guevara. I'm fourth semester parallel D. Today we're going to talk about ezetimibe added to statin therapy after acute coronary syndromes. We're going to talk about first. We're going to talk about the definition. The addition to statin therapy of a non-statin agent, ezetimibe, which reduces the absorption of cholesterol from the gastrointestinal tract, lowered LDL cholesterol by approximately 24%. The combination of simvastatin and ezetimibe also resulted in a significantly lower risk of cardiovascular events than with the static monotherapy, with a 2.0 percentage point lower rate of the primary composite endpoint of cardiovascular death, major coronary events, or non-fatal stroke.
Cardiovascular disease is the leading cause of illness and death in the United States. Statins help prevent cardiovascular disease in patients who have already had an event, but their use in patients who have never had but are at risk for cardiovascular disease remains controversial. Now, the United States Preventive Services Task Force, an independent volunteer panel of national experts in prevention and evidence-based medicine, recommends that adults without a history of cardiovascular disease use a low to moderate dose statin for primary prevention of cardiovascular disease events and mortality if they're between 40 and 75 years old, have one or more cardiovascular disease risk factors, and if they have a calculated 10-year risk of a cardiovascular event of greater than or equal to 10%. The task force says that physicians can offer patients the option of using a low or moderate dose statin if they have the same risk factors but with a calculated 10-year risk of a cardiovascular event of 7.5 to 10%. Finally, they conclude that evidence is not yet sufficient to assess the benefits and harms of starting statins for primary prevention of cardiovascular disease events and mortality in adults age 76 years and older. The task force acknowledges that estimating 10-year cardiovascular risk isn't so straightforward. The pooled cohort equations from the 2013 ACC-AHA guidelines on assessment of cardiovascular risk is the best currently available risk estimation tool, they say, but it may overestimate risk in some patients for unclear reasons. So they emphasize that the risk estimates should be the start of a conversation between doctors and patients about their risk of a cardiovascular event relative to the risks and benefits of starting statins and the patient's desires to begin lifelong statin therapy.
Now we're going to talk about the applications in medicine. The extent of benefit afforded by the simvastatin-ezetimibe combination is consistent with that seen in previous statin trials, with a similar reduction in cardiovascular events according to the degree of LDL cholesterol lowering.
Health Matters is the informational webcast brought to you by NetMeds, designed to keep you informed and up to date on popular medicines, emerging therapies, and even cutting-edge strategies for enhanced wellness, less sickness, and greater energy. This medicine contains two cholesterol-lowering medications, Ezetimibe and atorvastatin. It is used for lowering the levels of total cholesterol, LDL, that is, bad cholesterol, and fatty substances called triglycerides in the blood, raising the levels of HDL, that is, good cholesterol. It is used for patients who cannot control their cholesterol levels by diet and exercise alone. Talk to your doctor before taking this medicine. If you are allergic to ezetimibe or atorvastatin or any of the ingredients in this medicine. If you have active liver, kidney and thyroid problems. If you have diabetes mellitus. If you have an unexplained muscle ache or weakness. It may harm your unborn baby. If you are a woman of childbearing age, you should use an effective method of birth control while taking this medicine. Stop taking this medicine and call your doctor right away if you get pregnant while taking the medicine. The medicine can pass into your breast milk and may harm your baby. Talk to your doctor about the best way to feed your baby if you take it. Do not breastfeed while taking the medicine. Tell your doctor if you are taking, have recently taken, or might take any of the following medicines used for the treatment of gout, blood coagulation, viral infection, seizures, tremors, cancer, and folic acid deficiency. Refer to the table for detailed information on drug interactions. Stop taking this medicine and contact your doctor immediately if you notice any of the side effects such as unexplained muscle pain, tenderness or weakness, loss of appetite, nausea and vomiting, upper belly pain, dark urine, yellowing of your skin or the whites of your eyes, swelling of the face, lips, tongue and throat that may cause difficulty in breathing or swallowing. For further details, refer Consumer Medicine Information at netmeds.com. Pharmacy.
Now the pros and cons. The observation that a non-statin lipid-lowering agent can also reduce the cardiovascular risk, thus indirectly support the LDL hypothesis. In example, that lowering the LDL cholesterol leads to a reduction in cardiovascular events. But most importantly, it undercuts the statin hypothesis that somehow only statins are beneficial. This finding is notable in the several previous trials that have failed to show a significant benefit of non-statin lipid modifying agents when added to statins.
Acute coronary syndrome, or ACS, is the leading cause of death globally. The spectrum of ACS ranges from unstable angina to non-ST segment elevation myocardial infarction and ST segment elevation myocardial infarction. Ultimately, ACS is the result of an obstruction of the coronary arteries induced by an atherosclerotic plaque. ACS events are triggered by the plaque rupturing. This exposes subendothelial matrix proteins and other molecules. Platelets are recruited to the site, adhere to the injury, and, together with red blood cells and fibrin, begin to form an arterial platelet-rich clot. This narrows and eventually obstructs the coronary artery. The extent and the location of the blockage and the resulting myocardial damage determine the extent and the severity of the myocardial infarction. Life-threatening arterial clots are formed through two pathways: activation of platelets and generation of thrombin by coagulation factors. Targeting both pathways has been shown to be a viable therapeutic approach.
Now the issue of diet in Ecuador. According to data from the 2016 census of the National Institute of Statistics and Census, acute coronary syndrome was the leading cause of death of the Ecuadorian population. Hence lies the importance of an early detection of symptoms in patients who go to an emergency systems. Hence lies the importance of an early detection of symptoms for patients who go to emergency systems in every hospital. Now for the conclusion, the addition of Ezetimibe to statin therapy in a stable patient who had an acute coronary syndrome and who had LDL cholesterol levels within the guideline recommendations further lowered the risk of cardiovascular events. The event reduction was consistent with the predicted effects seen with the statins, even in the range of low LDL cholesterol levels in this trial, and no offsetting adverse events or toxic effects were observed. Thanks.